Hi, I'm Dr. Dutta. I'm a cosmetic surgeon at the Aesthetic Beauty Center. Botox is a protein which is obtained from a bacteria called Clostridium botulinum. The chemical is purified and then injected in very small amounts into specific areas to either weaken the muscle, or of course sometimes we use it for chemodenervation. That means chemically we are weakening the nerve, which produces a particular effect. Say for example, wrinkling of the face when we are moving the muscle, or producing sweat in the underarms or other areas where weakening the nerve which supplies the sweat glands. Since Botox is a blocker for nerves, we knew Botox was used for various types of pain conditions. In migraine, the Botox works in a slightly different way. It relaxes the muscles of the scalp, and hence if somebody has Botox around the temporal area and they had a frontal headache, that means the headache in the front of the head, we find that the Botox used to help the headaches for those patients. Recently, and as near as 2011, FDA approved Botox for the use of migraine. Although we have been using Botox for migraine for the last 8 or 9 years, now that it is approved, it has come to common knowledge. People are more aware of this treatment being available, and sometimes this treatment is available on the NHS as well. It works by weakening the nerves, by relaxing the muscles and reducing the migraine headaches. In some patients I have seen the migraines being reduced from 10 or 15 days of the month to something like 1 or 2 days of the month. It improves the quality of life. It gives the patients so much confidence to get out and do things. And I think it is a treatment that is going to take even further into various types of treatment for pain conditions and headaches in the future. In general terms, when a patient is diagnosed with migraine, we advise them to go for the medical treatments which are standard and has been used for the last umpteen years. If 1 or 2 of those treatments fail to relieve the symptoms or even reduce the frequency of migraine, then only we advise patients to try botulinum toxin A or Botox for migraine. But we must also remember that all types of migraine may not respond to Botox treatment, and even in some patients we find that the Botox may not be effective at all. So it is to some extent unpredictable which particular patient will benefit from it, but when it does work for a patient, it is absolutely wonderful and the patient's life changes for the unforeseen future. For patients with migraine, if Botox works, the effect should last for anything between 12 to 18 weeks. In some patients we see the effect is slightly short lasting, but in most patients I would expect them to have at least 3 if not 4 to 5 months of relief from their migraine headaches, or at least reducing the frequency of the migraines they suffer. And hopefully that will improve the quality of their life as well.